Despite the country making remarkable steps in development, several areas still lag behind in development, hence posing a challenge to service delivery in the said areas.
This is an essential facility in our ward, which is at the center of this ward. We believe that if this facility is improved or even uplifted in a manner, our people will be able to access the medical services across the ward because it is at the center.
We are at Ekerubo Health Facility or Health Center, and the facility started way back in the year 2006 by then Member of Parliament, the late Dr. Hezron Manduku, with an objective of ensuring that our people are taken care of.
In Ichuni ward, Kisii County, residents still lag behind, missing essential services like health, passable roads, and lack of clean drinking water.
For fathers, we grew up knowing that Ekerubo came from that that situation. That is a Swambi place, according to our forefathers. And as you can see, for example, as we start from looking at the challenges that the facility is facing, is about the swampy, the water. When it rains, like now, it's raining heavily. At least every day we have rains. Now when it rains, we have water that is being stagnant water. And when water is stagnant, it is a home of mosquitoes. So they bleed, and mosquitoes are some of the factors that cause or bring out malaria in our families. So you find that people are affected. People living within this area of Ekerubo, they get affected if they don't have the nets.
In health, the ward has 3 facilities, all struggling to meet the needs of the residents day in, day out.
Of course, we have 2 more other facilities, including this one here, but our major focus here, because this one is at the center. So this is our facility that we believe that it should be worked on in a manner that it offers more essential services to our people in the basic reason that it is at the center of this ward.
So my friend, over this time long,
yes,
what has created the negligence of this case? Offense is something that could have been done a long time ago.
It is, yes, but I don't want to allege on some information that I cannot substantiate. But most things do happen because of corruption, the ignorance, the personnel that are maybe put to manage the hospital itself. They are not conversant. They don't have that information about management. Now, because they are being maybe appointed politically, and maybe you find that this politician or this person that has maybe.
Our visit to Ekerubo Health Dispensary, Ichuni Ward, Kisii County, proves the situation as the hospital management explains to us.
Now, it's so pathetic. We cannot blame maybe the previous regime. We cannot blame anybody, or you may not be at a position of basing any claim to or blame to anybody. But from the look of things, you can ask yourself, from the previous regime, what did they do as the committee that was present?
How about this structure, this one?
This is when we were here last time. When we were here last time, the in charge of this facility, that is Madam, told us that this is a maternity wing that is being built. It is not in completion. So it means that it lacks some funds to enable it to come into its completion, and some of the equipment inside. When we went inside, we found that it's something that is upcoming, but it has not come to its conclusion. But when you look at the structure itself, it's like it started sometimes some long time ago. So the major cause of its maybe the way it is, it's because of let's say the lack of funds.
Ekerubo Health Center is one of the largest and central facility in the world, but still lacks fundamental services that should be provided in the facility.
We've received reports. Yes. Many reports are coming from the members of the society that we have a challenge of women delivering here. Sometimes they deliver on the way coming to this facility, that is on the way coming to this facility. Sometimes they deliver outside the gates because of lack of enough personnel to attend to them. And the facility itself, they don't have that equipment or the equipment that will make delivery to be successful. Now you find that they have moved from here to the other side of the county, that is Nyamira, that is Keroka General Hospital. That is where they go, Keroka Sub-County Hospital. That is where they normally go to do some deliveries, which is in Nyamira County.
And what is the distance between this facility and the town?
Keroka? From here, I think it's about 5 kilometers. Yeah, 5 kilometers. Right. From Keroka to this area, it's 5 kilometers. Right. Yep.
Can we all go around this facility?
Yes, we can continue. These are the toilets of the maternity wing. Yes.
But they look could have spent a great budget to be built, and if they could be completed, then I think they could be serving the purpose.
Yes, it could be serving the purpose. Right. Yeah, completely. It's a nice facility when you get into it, the inside part of it. It's a nice facility, even from the outside. The designers, of course, came up with a nice way. Like now, if you can see the toilets, they are being enclosed to the facility itself, meaning that there will be no challenge for those mothers that have maybe delivered for them to get inside to relieve themselves.
How about those stripes that looks like darts around that? Don't you think the water flowing from above this uncompleted structure could maybe affect it?
Definitely. Water, it's important. But sometimes when it's too much on something, it causes destruction. So don't be shocked or worried sometimes when you come next time, you find that this place, the way water is coming down, it's affected completely. So some other mechanisms need to be looked into. I think this facility, if the leadership can take it serious, it can serve many people, even from outside other wards within. Like now we are neighboring with Kiamokama, we are the neighbors of Birongo. We are the neighbors of Birongo ward and Kiamokama ward. These people can come and get served if at all the leadership will take into consideration about working on this facility around here.
Despite being started about 15 years by the then area MP, Honorable Hezron Manduku, the facility lacks a proper maternity wing, as one started by the then late Manduku stands stall up to now.
Ekerubo yabeire ngaki atoigwete nga yare komenta ebenene egere abantu baitu mbakonya koendare buna bona abantu bakoenda satambe kurwa abandi onyora abagutumu bagenda ibacho bachi gopimwa ororo bamanya koreta amachibu iga toigwete ng'a mbuya yare koba facility eye yaito etware ebinto ebi bionsi abanto bachicha bapimerwa iga arafu amachibu atokeraga barwareriwa ang'e naende kobua mono enyagitari eye iga nchachagete abaswati bare gocha banyorera abana iga iga chingaki chiabeire rero mbari konyorera iga iga ase eng'encho ntomanyeti na ebinto bitaiyo bigokora ase maternity ninki gekogera naki giansinyire nyigwete tonyore ng'a inki gekogera enyagitari yaito abaswati batari kogonkeria iga iga ase amatuko aya iga
ito gose nonya isiko bakonya nyagitari eye emokereri igoro ekiagera bono amarwaire abuchire na abanto mbaganeti korwarigwa egera nario abanto ase oborwaire bore magendero takoba lakini ase abanto babwate afya engiya no amagendero arabe igo tware gosaba ng'a abanto baito batokonye nyagitari eye egere nene abanto banyore baronyora oborwari ase nyagitari eye yaito ase kera egento anene buna bono abang'ina baito bagotoraberia ase atambe sana koenda konyorera abana ororo na nekara omong'ina akonyora omwana tari gento gegwaka odi na egento gegocha kende yonsi igo bono ekare nyagitari ase gotoka ng'a nebwate maternity ere engiya ase toranyore oborwari obo nabo abang'ina baito bare konyorera abana ang'e egere ntotinya gotwara abang'ina bagotosirera twatigara abana batigara bari chintakana.
The residents attribute the stall project to negligence by the authorities over time, lack of proper political goodwill, and lack of enough funds to aid its completion.
Something must be done. This facility, let it be improved, let it be empowered, so that now we can have a maternal wing. Our mothers face a challenge when it comes to delivery. We don't have such an essential service in our entire ward, because even the RAP services which are essential, because for a patient to be treated well, he has to be examined, he or she has to be examined. But it is quite unfortunate that we don't have a lab here that is well equipped. If they need to do a referral, they have to do it to Kisi, within our county. The nearest they can refer someone to is Kisi, which is miles away.
It's evident that the facility has enough land that could be utilized in a proper way to offer health care to the residents of the ward.
The main is that this facility has large land, which we feel that it has to be properly utilized for the medical benefit of our people. As you can see, it is a large land which is unused, which we are hoping that it can attract more structures for more services to be offered here, because you see sometimes you see the cows coming in to graze, which is not the best reason of this land. This is a public facility. This is the public land which we want as a ward, which we as a ward we intend that this land should be put into its proper use. Let it not be remaining idle. Let us see the structures being set here, so that our people will not be they not be served or strained much in accessing the facility, the services elsewhere, which otherwise could have been set up in this unused land here.
Other than lack of a proper maternity wing, the facility faces a challenge of no proper medical waste disposal area and a challenge of staffing.
Maybe could you explain to me what this hut-like structure looks like?
Yeah, we have a structure here, and it's obvious. In every health facility, we must have a place where we dump our whatever there. So in this institution, this is one where the dumping is done. The dumping is done, but looking at it honestly, it is not up to the standard. So again, we are appealing that it has to be worked on properly, so that now it is to the right standards. Because see the way it is exposed, and the condition in which it is indeed is not appealing at all. So we strongly believe and request that it has to be worked on properly, so that now maybe the objective can be well achieved. Yes.
Leave alone working on it.
Sure.
Do you think it should be maybe made inaccessible? I can see children from a distance, and they could be tempted to use the medical apparatus. They could harm themselves or even contact diseases. Now,
security is paramount for this facility, starting from the fence, and even this site alone, it has to be enclosed. When it is enclosed, that is the only way that it will not be accessed by the children, and even someone may be passing here without knowing, and they may end up stepping on a needle or another thing. So basically, it has to be enclosed. This is where they dump the placentas after delivery. This is where they dump the placenta. Which, looking at it indeed, you see that it is really wanting.
Why should it be left uncovered?
Uncovered. Now, that's why we are saying that the facility needs a lot of assistance. We are really lacking a lot. This hole should not be like this, because the way it is open, anything can happen. It is a security threat, and at the same time, should be covered in a manner, because remember here we dump the placentas. So when it rots, even if they are treated to some point, you may see that now maybe the nearby environment can be polluted, and the way it is open, even you see a road here, people can be interested to look at it. If it's a child, can drop inside. So it has also to be worked on.
According to the medical personnel in the hospital, the facility serves up to 200 people in a week. Hence, there is need for the services to be bettered in the facility to avoid or cut costs of referrals to other facilities which are miles away in the county.
We have, at the moment, we have 2 nurses at this facility who are working actually. They do day and night, which is a bit hectic for them. Yeah, if we could get some more staffs, could have actually improved this facility because I've seen the land size is so big, it's quite enough. We can lift this facility to a level 4 facility. And as comparing to the catchment, the way I've gone through, this facility needs a level 4 facility. I was asking myself a question: what if you get an emergency? A mother who needs to deliver and need a cesarean section. Before this mother transferred to somewhere else, she may complicate in between.
Today we can see roughly 35 patients in a day when there's a heavy workload. Then we have the patient support center clinic. If we have booked clients, we can see like in a day also 20. In total, we have 162 clients who are visiting our clinic. Then we have our MCH, that is mother-child clinic, where we offer immunizations. We offer antenatal clinic, that is to the pregnant women. Then we have family planning clinic. In a day, in MCH and family planning and MC clinic, we can see like also 20 clients in a day.
Ichuni ward residents now appeal to the government and any well-wisher to step in and aid its completion of the maternity wing to offer the essential services to hundreds of expectant mothers traveling miles to meet the service.
Tutagete nyasare gwanje abaraya babasoire batokonye enyagitari eyekine egendere kwanza chinyomba echi chitaraera chiere arafu maternity ebe buya abarwaire baito bonsi bari barwarete barwariguga iga ase burwaire bonde bwensi
abantu mbaroro bambasokire isiko barorera abantu baratokonya nabo twari kuria abantu abo egera bakonya nyagitari eyito egera imoke igoro kiara toisa ku depend chibasa chikuru ase serikali yoka inchi gokonya nyagitari eyagere kine goika tonyora koboko okung'ago kurusiko korabeka gotokonya